Good morning. The title of this talk is Consequences of Using Sunbeds, Health Risks and Aging Effects on the Skin. Many thanks for asking me to present at this webinar, and I apologize that I'm not there live. So by way of introduction and to let you know my background in skin cancer, I'm a consultant plastic and reconstructive surgeon at the Mater Hospital in Dublin and Blackrock Clinic in Dublin. I'm also associate clinical professor in UCD, where I conduct translational research in skin cancer in the Conway Institute. I'm also one of the national clinical leads in skin cancer with the NCCP. I'm chair of the Irish Melanoma Forum and a chief investigator with Cancer Trials Ireland on international melanoma surgical trials. So a good bit of background in terms of skin cancer management and treatment. So by way of introduction to this presentation, I'll signpost with an introduction to skin cancer in general and in particular skin cancer in Ireland. And then I'll go on to describe the deleterious effects of sunbeds in terms of skin cancer and skin aging. Skin cancer is the most common cancer treated in Ireland, and it outnumbers all other cancers. And each year we treat about 13,000 cases of skin cancer in Ireland. There are many different types of skin cancer, and these are the three most common. The first being basal cell carcinoma on the left of the screen, which is a very common tumor of the skin. And however, it is not very serious and causes the least in terms of morbidity to patients. The central one is a squamous cell carcinoma. This is usually an ulcerating, crusty type lesion. Again, very common, but it does tend to spread and can be more serious and aggressive. And the one on the right is a melanoma. This is a pigmented type of tumor, brown or black patch on the skin. These are not as common, however, they are much more serious in terms of the effects that they have on patients. So given that most Irish people wear suntan as a badge of honor, and most Irish people have a very fair complexion, we do have a significant skin cancer problem in this country. Melanoma in particular is one of the most aggressive types of human tumor when you compare it to all types of tumors we see in humans. It's the fourth most common cancer in males and females, and its incidence and mortality in Ireland are amongst the highest in Europe. Melanoma and skin cancer in general are increasing year on year, and we're going to see an explosion in skin cancers due to lack of awareness in terms of what it looks like, and also a lack of sun protection measures that have been taken over the years. And it's expected by 2045, we'll at least see a doubling of the incidence of skin cancer in Ireland. When we look at melanomas in particular, melanomas appear as a brown or black patch on the skin. About a quarter of them occur in pre-existing moles, and about 75% of them occur as a new mole or a changing new mole. So we use the ABCDE system when we're looking at moles to identify whether or not a mole is suspicious or not. So a mole can be termed suspicious if it is changing in terms of its asymmetry. It's no longer a circle or an oval shape and it becomes an irregular shape. If the border looks very irregular with little arms sticking out, if the color starts to change in terms of different shades of brown or black or even pink, if the diameter changes, we describe things as over 6 millimeters as becoming suspicious. And also if a mole is changing or getting satellite lesions or changing in a different direction. So the lesions along the bottom are all melanomas of different types and all raise an index of suspicion and would warrant clinical treatment. We also use the ugly duckling sign, whereby we describe a melanoma or a suspicious mole as a mole that looks different from all of your other moles. So these are ones that should be checked by either a GP or a dermatologist. In terms of the causes of melanoma, 90% of them, i.e. the vast majority of them, are caused by exposure to sunshine and UV light, be that chronic exposure over the course of a lifetime or short, sharp bursts of exposure in the younger years causing blistering sunburn. So saying that 90% are due to sun exposure, that means 90% of skin cancers and melanoma in particular are probably preventable with the proper measures. 10% are caused by genetic factors that we can do nothing about due to linkages within families and genes carried passed down through generations. These are some of the information posters that we had up in the hospital during Melanoma Awareness Month and Skin Cancer Awareness Month, which has just gone in May. And they give some of the stark statistics about skin cancer and melanoma. So if you look at this one on the left, it says that 3 or more instances of severe sunburn before the ages of 20 increases the risk of melanoma later in life by 2 to 4 times. And the one on the right is probably even more striking and more relevant to this presentation, stating that people who use sunbeds for the first time below the ages of 35 have a 75% increased chance of getting a melanoma. So what are sunbeds? Sunbeds are devices that emit ultraviolet or UV radiation with the aim of tanning the skin. UV light comes in different types, but mostly in UVA and UVB. UVA has a longer wavelength, and as you can see here, penetrates into the deeper layers of the skin and is more associated with the aging and the wrinkling processes that happen because of sunlight. And UVB is a shorter wavelength. It penetrates less into the skin, and it's the type that causes burning and in particular associated with skin cancer risk. Both UVA and UVB are associated with skin cancer risks. So what are the health risks associated with sunbed? Well, definitely skin cancers. And as I've said before, sunbed use increases the risk of skin cancer by 75%, which is quite a striking statistic. And that would be in terms of melanoma, which is the most serious type of skin cancer, but also in terms of non-melanomas, which would be the basal cells and squamous cells that I mentioned previously. And this increased risk is associated with the increased frequency or the number of times you use a sunbed or the longer you use a sunbed for. Also, using a sunbed in the younger years, especially less than 30, significantly increases your risk. And definitely people with a fair skin or very pale Irish red hair, freckles, that type of skin definitely has a higher risk of developing skin cancer from sunbed use. So the World Health Organization has classified sunbeds as a definite carcinogen, i.e. they definitely cause cancer. And they would come in the same category as smoking and asbestos. So quite significant. And a significant statistic that I reached out from the UK is that an estimated 100 deaths occur per year from melanoma associated with sunbed use. And if you look at this infographic from the WHO, they show the striking statistics of before the age of 35 using sunbeds. They state 60%, but evidence would definitely show up to 75% for melanoma risk. And also using them below the ages of 25 increases your risk of squamous cell carcinoma by 102% and basal cell carcinomas by 40%. So quite significant statistics associated with sunbed use and skin cancer. What are the other health risks associated with sunbed use? Well, definitely eye damage, and they cause cataracts and ocular melanoma. That's a type of melanoma that occurs within the eye and is really quite serious, as well as causing sunburn around the eyelid skin, which is again quite unpleasant. The sunbed and UV exposure associated with sunbed use causes weakening of the immune system, reducing the body's ability to fight off infections and other diseases. Sunbed use and UV exposure causes direct damage to the DNA within our skin cells, increasing the rate of change of the skin cells and leading into other types of cancer. And just a myth that I'd like to bust is that you don't need to use a sunbed to get enough vitamin D. Unfortunately, that's not where it all stops, and sunbeds have a significant effect on photoaging or premature aging of the skin, and that's an accelerated process that occurs because of UV exposure, and in particular UVA. The visible signs that we see on the surface are wrinkles and fine lines, loss of skin elasticity, hyperpigmentation or age spots, which are brown patches in the skin, and a rough leathery texture to the skin. So the mechanisms of skin aging caused by UV light, UV radiation degrades collagen, which is a protein within the skin that causes skin firmness and elasticity. It causes damage to elastin, again another protein in the skin, which gives the skin its bounce and resilience. And it causes increased free radical formation, which damages skin cells and leads to accelerating aging. The picture on the right of the screen is a gentleman from Australia who worked as a truck driver with the window down for prolonged periods during the day with high UV exposure. And you can see the left side of his face, which would have been exposed to skin for chronic periods over the course of his lifetime, shows dramatic effects of aging, whereas the right side of his face has significantly less signs of aging because of less UV exposure. Here are just some other examples of UV exposure because of sunbeds. And I give you the example of this young girl on the bottom left of the screen. The image that we would like to portray as a healthy image is that of an untanned skin. Any tan is considered unhealthy and definitely has caused some damage to that skin. The top right of the screen is an actress who has used sunbeds for 20 years to increase the glow of her skin. And you can see under the UV light the amount of damage that's there, and it will come to the fore as she ages, resulting in earlier aging and increased risk of sun cancer. And the image on the bottom right is a young girl called Sandy, whose image in the center is shown as it is today. And then software has predicted it as she would be at the age of 52 without sunbed use, not looking too bad. And then with sunbed use on the right, with significant effects of aging and wrinkles and fine lines and loss of elasticity of our skin. So what we'd like to promote is safer alternatives to sunbeds, and these are available readily over the counter, and these would include lotions, sprays, and self-tanning products that do not involve UV exposure and give you the same appearance, and also to promote protective measures, encouraging the use of sunscreen and protective clothing that you'll hear about later in the webinar, and limiting the exposure to sun, especially in the peak hours during the day. So to conclude, skin cancer is a significant public health problem in this country. UV exposure is the cause of the majority of skin cancer, and therefore the majority of skin cancer is preventable. There are significant health risks associated with sunbed use, and these include skin cancer risk, eye damage, and damage to the immune system. And also, importantly, the secondary effects on skin aging and the accelerated aging that sunbeds cause on the skin with visible signs and also internal damage. And we would like to encourage everyone to consider safer alternatives and to prioritize long-term skin health over a temporary tanning. I'd like to thank you for your attention, and I'm happy to answer any questions if you want to send them on to the organisers. Many thanks.